Bernhard Müller, AbbVie, Multiple Sclerosis Therapy. The next goal is neuroregeneration and neuroprotection.
Yeah, hello, good evening. It's a pleasure for me to be here and to give you a short update of the AbbVie neuroregeneration program. So I will give you a few information about an antibody which we have in clinical trial, just starting to treat MS patients, an antibody which promotes regeneration. And what you see here in this picture is green snakes growing through a red environment. Red environment means it's an inflammatory lesion in the spinal cord. The inflammatory lesion in the spinal cord results in hind limb locomotor impairment. And what you see when you give the antibody is that the regenerating fibers are able to really grow into this inflammatory region. So I will end my talk with a short view on the spinal cord injury in a monkey model, how the antibodies behave. Oh, that's a little bit too far. As you know, multiple sclerosis is the most common neurological disease of young adults. 2.5 million people worldwide are affected. The disease is clearly an autoimmune system disease. It is driven by aberrant immune system activation. Most of the drugs, 12 we have on the market currently, they interfere with the immune system dysfunction, but they do have no direct effect on neurodegeneration or promoting neuroregeneration. And clearly, when you look at neurodegeneration, it's very massive, as you can see in this picture. There's a picture of a spinal cord section from a control person. You see many black dots, axons. And you see in a MS lesion, end-stage patient, where you see that many of these dots are gone. Patients usually lose 70 to 80% of axons in spinal cord or other brain regions, corpus callosum. So therefore, we need drugs which really promote neuroregeneration, which reduce neurodegeneration. And our antibody against the repulsive guidance molecule is one of those candidates. So this antibody, as you know, regeneration in the brain was regarded as being impossible due to many stop signals, and repulsive guidance molecule is an inhibitor of stop signal in the CNS myelin scar tissue. Our lead candidate, ABT555, is in clinical trials in MS patients and will hopefully go into spinal cord injury clinical trials next year. To show you in the next slide how these antibodies work, this is a hemilateral transaction model in macaque monkey, cervical lesion, hemilateral lesion at C6, C7. And what you see here is, this is a monkey which has been treated with a control antibody. You see right arm, right hand is paralyzed, not able, that's 14 weeks after injury. And when you now look at the RGM antibody treated animal, you see that this animal has a recovery of more than 70% of its function. So we hope very much that we will achieve that also in humans, and we will see that next year. Thank you.